Welcome to this module on support plans, risk assessments and outcome-focused support. Before you can write an excellent support session note, you first need to understand what you're trying to achieve. Every support session should have a purpose. That purpose comes from two important documents: the support plan and the risk assessment. Think of these documents as your roadmap. They guide every support session you complete. They tell you what support the tenant needs, what risks exist, and what outcomes you're both working towards. Without them, support can quickly become reactive, inconsistent, and difficult to evidence. A good support worker doesn't simply ask, "What shall we do today?" They ask, "What can we do today that moves this person one step closer to independence?" That's the difference between activity-based support and outcome-based support. A support plan identifies the areas where someone requires support. These might include managing finances, registering with a GP, mental health, drug or alcohol recovery, independent living skills, employment, education, physical health, social isolation, housing applications. Every support need should have an agreed goal. That goal should describe what success looks like. For example, instead of writing mental health, write, "Sarah will attend weekly well-being walks and access counseling to reduce isolation and improve her emotional well-being." Notice how that goal can now be measured. Support sessions should then focus on achieving that goal. Risk assessments work slightly differently. A risk assessment identifies anything that could cause harm to the tenant, other residents, or staff. Risks may include self-neglect, substance misuse, self-harm, suicide risk, aggressive behavior, domestic abuse, financial exploitation, poor physical health, hoarding, fire safety concerns, medication non-compliance. But identifying a risk is only the first step. The important question is, what support can we provide to reduce that risk? Let's use an example. The tenant has a history of alcohol misuse. The risk assessment identifies relapse as a significant risk. Rather than simply recording the risk every week, support sessions should actively reduce that risk. This might involve referral to CGL, attending recovery meetings, developing relapse prevention strategies, building healthy routines, increasing social support. Every session should demonstrate progress. Over time, the risk may reduce. When that happens, the risk assessment should also be updated. That's why all of your paperwork links together: referral, assessment, risk assessment, support plan, weekly support sessions, evidence, quarterly review, updated risk assessment, updated support plan. This is known as continuity of support. Auditors aren't looking for perfect paperwork. They're looking for a clear story. Can they see how support has helped someone become more independent? Can they see risks reducing? Can they see goals being achieved? That's exactly what good documentation demonstrates. Finally, remember that support plans and risk assessments are living documents. They shouldn't sit in a folder untouched for months. Whenever significant progress is made, whenever new risks emerge, or whenever circumstances change, these documents should be reviewed and updated. In the next activities, you'll practice identifying support goals, recognizing risks, and deciding how support can help someone move towards independence.